the FDA start being more aggressive in software. And the truth is, but on the other hand, the truth of the matter is, so our product, for example, does dose. It does actually provide dosages, and so you could see the argument. I think the good news is, although the medical industry is 20 years behind every other technology, it is at least reaching the 1990s now. I think the present administration has at least nominally been interested in trying not to stifle innovation. One of our founders, Todd Park, actually was asked to become the CTO of Health and Human Services, partly because we were so active in trying to maintain innovation in the face of regulation. And so Obama was basically like, well, why don't you show me how it's done? So I think there is a thirst for innovation in healthcare. It's obviously the current administration at both the national and the local levels. I think there's kind of this acknowledgement that we have to find kind of the easy balance. In the interim, the good news is I think that there is an opportunity. We've talked about a couple of companies whose bread and butter really is helping providers deal with HIPAA, helping other software companies deal with innovation. HIPAA for us was a godsend. Honestly, it was really our first real success. And I can remember in 2003 when all the standards came up. One of our selling points was to the doctors, don't worry about it. We're going to worry about it. You don't worry about it. And so if you can position yourself to take on some of that complexity for your customers, it's actually an opportunity. So.
One more. I want people taking notes to write down that Jack said HIPAA is a godsend. I want that in writing, and somebody needs to get that on the record. One more question. Yes, sir.
This is for the panel. We're all here because healthcare is so expensive, aging population, all that good stuff. Everybody here is interested in making that better. I just like to hear the value proposition of each one of these folks about how they're improving efficiencies.
Efficiency, cost, effectiveness, the other big monster.
Just kind of like what these four things you're doing to help this whole industry.
Okay, well, I'm trying to keep the government out of healthcare, so I'm definitely.
All right, great question, thanks. It allows us all to pitch, which is always fun. So, just as a summary, and everyone already knows this, before any drugs can be made available to the general population, they have to go through clinical trials. It's an absolutely mandatory thing, it makes sense, but there's a problem. The problem is that 86% of clinical trials run behind because of patient recruitment issues. And I'm going to pause for a second and let that sink in. Because that's not, most of the trials or a lot of the trials. That's almost every single one runs behind. And they run behind by months, if not years. So what that means is there could be the next big cardiovascular drug, or a drug for Alzheimer's, or a drug that addresses any of these horrible, horrible diseases that already exists, but it's stuck in this process. So something else to add to that is that this problem's getting worse. It's getting worse because of the personalization of medicine is creating more and more new drugs, and the complexity of these clinical trials is getting worse and worse as well, because you need to find more specific patients for each of these trials. So what ePatientFinder does is we serve as a clearinghouse of information. What we do is we have a platform that allows all of our physicians that we work with physicians that are independent practitioners, work in ACOs, work at hospitals, etc. It allows them to learn about the clinical trial opportunities that are available for their patients in their area. And that in and of itself is pretty cool, but there are other resources they can use. We try to tailor it, and we try to help them filter signal from the noise. But the real value proposition for us is that we provide those physicians with software that they can integrate in with their existing electronic health record system And when they find a trial that they're interested in, they can click a button and they can identify exactly which of their patients might fit the criteria for that trial or might benefit from that trial. And they can use that information in order to make sure that their patients are aware of all of their treatment options, as opposed to just the treatment options that the physician happens to remember or happens to know about when the patient presents at the point of care.
So our stuff is simple. In healthcare, there's a concept called care plan, which is essentially a list of tasks, a series of steps patients must complete in order to arrive from a disease state into a healthy outcome. That care plan is largely delivered today as a piece of paper, a mailer to the patient, or in most cases delivered by a team of nurse coaches over telephone. So there's a lack of scalability, a lack of accountability, etc. Our platform allows those providers to take that care plan and deliver it down to any patient touch point, whether it's mobile, email, SMS, etc. So we make it convenient, we make it accountable, and we make it scalable. And as we move into an accountable care model, we fundamentally believe this is going to be a backbone of that, and we're enabling technology across the healthcare space.
Our basic elevator pitch, I guess, for Athenahealth is that we come into a doctor's office and try to take over everything that isn't actually healthcare, that isn't actually healing. We do scheduling, billing, patient communication, we handle the clinicals chart. We take on all that, we do a better job than they could do locally, and we increase their revenue, I think on average by 12.5%. And then we take a cut, like 6 or 7%, depending on the size of the practice. And so how does that lead to efficiency? As I was saying earlier, by taking on all of that, we are, in aligning ourselves with the provider, we're incented to do it as cheaply as possible, as quickly as possible, and as accurately as possible. And so, you know, we started off when we were first doing billing, we started off actually literally signing claims with pens and putting them in envelopes and sending them out the door. And now we're like 90-something% electronic with claims. Similarly, eligibility, patient insurance eligibility, we originally were just picking up the phone and doing phone calls, just like our providers were. And now, you know, almost all of our eligibility work is done transactionally. So by taking on all that complexity ourselves, basically we've incented ourselves to look at ways of reducing the complexity, increasing the efficiency. And then, even if we can't in the short run, by taking it on ourselves, we at least let the doctors focus on being doctors and their kind of comparative advantage. And yes, someone's still making phone calls, but at least it's us rather than them. So that's our model.
For healthcare stores a massive amount of information. Most of that information in healthcare today is stored in relational databases. If you think tables, which are rows and columns of things. And our ability to work with these databases has been lagging for probably over 20 years. The ability to do it quickly, do it inexpensively, and do it in such a way as that it's accurate. And so there's a need for technology to emerge to allow databases. If you try to take an Oracle database and a DB2 database and try to form a team of people and buy the tools and rent the software and the space necessary to build a team that's going to bring those two databases together, it's mind-boggling. And you don't wonder that until a merger occurs of one hospital system and another. Now their clinical systems don't talk to each other, their financial systems don't talk to each other, supply chains don't talk to each other, and it takes them 10 to 15 years to try to at least unwind some of that data. Our technology works with semantics, and it moves relational data. It actually doesn't move it. It lets these relational databases sit where they're at, and we're able to view relational data as a triple store. Once it's used as a triple store, I can use any relational database as a triple store. I can merge them immediately, and I can search the entire federation. Right now, we're at scale with 195 databases worldwide doing federated search of 7 different database types. And the power of that is it's going to bring speed. It's going to unlock some of these organizations who've been sitting on these large silos of data that they can't do anything with. And the last thing that I'll leave you with a lot of is everybody's trying to do these ACOs, accountable care organizations, in which payers and providers are trying to get together. And most of their contracts say, I'll send you my data if you send me your data. There's been petabytes of claims data moving over towards the payer organizations. There's been petabytes of clinical data moving into payers' organizations, they don't know what to do with it yet.
Hi guys, so we effectively solved the problem of, hey, I need help. Can you come and look at this? And it's a remarkably simple problem. In fact, it's so simple most people don't even realize it's a problem. But healthcare, if you think about kind of healthcare delivery, is extremely fragmented. It's fragmented across location, geography, and time, and discipline, and kind of level of authority. So if you need any specialist, the likelihood that like, okay, my heart hurts, I need a cardiologist. Like, how do I get to a cardiologist? There's a lot of challenges in getting people around quickly. And so we help move people around in a really compelling form factor. Most basic healthcare delivery requires some form of hands-on whatever, whether it's taking your blood, or doing an exam, or feeling on your chest or your stomach or your leg or whatever. And getting images and video through glass is a really compelling way to do that ergonomically. Right? Desktop computers were never designed for doctors. Desktop computers were designed for accountants. The very first application that drove adoption of computers was Excel. And then the next one was Word. And the next one was email. And the next one was Google. And none of those were ever designed for doctors. Those are things doctors do on the side, but they're not part of care delivery. And so glass is a really compelling form factor to help people look up information and capture and share information in a way that's really compelling ergonomically, given the constraints of their job. So we help connect people more effectively. We're doing that both on the healthcare delivery side, think neurologists and ambulances, doctors and home health programs. We're also working with device companies on training programs with like new types of surgery, or even working with equipment manufacturers in the hospitals. Like if the MRI at your hospital breaks and you're in the ER and you need an MRI, and they're like, sorry, the MRI is broken, like hold on for a while. So we now have customers who, the radiology technician has an MRI, the radiology technician, they have a glass from their MRI manufacturer, and instead of waiting for the Philips or the GE rep or the Siemens rep to drive out there and fix it, they literally start diagnosing and fixing the problem in minutes as opposed to hours, which leads to massive cost savings and time improvement. So our customers are coming up with all kinds of ways to use our technology that we never really thought about, but remote collaboration.
Figured out how to do this, right? I hope you're all inspired by what you just heard, because this is the future of healthcare, and it's being built in Austin, Texas. And that is freaking amazing. Amazing.